Hello everyone, I'm Dr. Tamim. I'm medicine faculty in DBMCI. We have with us Dr. Lakshitha. She's got a very good rank in this recently conducted NEET exam. So please introduce yourself and tell something about yourself.
Hello, sir. I'm Lakshitha. I did my UG in Madras Medical College and I secured a rank of 141 in NEET PG 2023, sir.
Wow, 141 out of more than 2 lakh people. How does it feel?
I feel very good, sir. I'm very
Great,
happy.
great. So see, there are many who tried in their exam and also a lot of your juniors looking at you. I think all of them must be keen on understanding how to crack this because so many thousands prepare and a few lucky ones get in the top ranks. So if you can just give us an overview of how you started. So first of all, when did you start your preparation?
Sir, I started my preparation like a serious way in the month of June, sir. So I had very limited amount of time. I had only 7 months, sir. So with that 7 months, I thought I should somehow crack this exam. So I stick on to my notes, sir. I didn't refer any other materials because I didn't have enough time, sir. So I thought I'll stick on to my notes and I revised it multiple times. Along with that, I did all my PYQs. I really concentrated my PYQs topics. I didn't want to go wrong in those aspects and also gave my GTs very regularly, sir. So I was consistent in these things. So in 2 years.
Great. So you attended the face-to-face classes or online classes with us?
Sir, I joined Bhatia in second year, sir. I attended the foundation classes, sir.
Great. So 2-year course that was.
Yes, sir.
Right. So in that time, were you able to complete your notes? Were you able to make all your notes?
Initially, when I joined, I was not very serious, sir, but the classes were very interesting. So I started making notes, sir. And I think that really helped me to build my basics very strong, sir. So it really helped me to revise all the first year, second year subjects very well, sir. So it really helped me during my final year and eventually during my preparation times also, sir.
Great. So which college is your UG? I think Madras Medical College, no?
Madras Medical College.
Right. So internship must be very hectic. So how do you plan? And were you able to do any studies in internship, or was it mainly post-internship preparation?
It was a post-intern preparation, so
Right.
during
So
time for preparation.
how many revisions were you able to put in?
I revised around 6 times, sir.
Wow, 6 times is fantastic.
I,
And how was your improvement in grand test? Like when did you give your first grand test? Did you give it in the foundation course itself, or was it after internship?
I gave it long back, sir, but my scores were very bad at that time, sir. So I think I took the grand test in the month of August, and it was again very bad score, sir. It eventually progressed, sir. Eventually with
Kept
months.
improving.
Yeah, yes.
Right. So I think one of the major questions is the last 40 days people struggle to revise. They just don't know what to do at that point. So how do you handle that last 40 days?
Sir, I usually make a schedule for 15 days. So that's how I progress with my studies, sir. So I actually plan that I should make at least 5 revisions, sir, before the last 14 days. And for the last 14 days, I have to make like a final revision. So that 14 days is very important. So what you learn in that 14 days is going to be retained in memory. So it's very useful during the examination. So I finished my 5 revisions before that, and the last 14 days I again planned. So very volatile subjects I revised just 2 to 3 days before the exam. So one day before the exam, just one last minute topics like very volatile stuff I revised. So that's it, sir. And
What percentage of your time were you doing theory? What percentage of time was it MCQs?
sir, as I said, I usually make a schedule, sir. So if I have to finish anatomy today, I'll finish anatomy today, and I'll have spare 1 or 2 hours. So I'll do MCQs in that 1-2 hours, sir. Around 150 to 200 MCQs per day, if possible.
So roughly around 20% of your time you're doing questions.
Yes, sir.
Okay, right. So what faculties in DBMCI you like the most?
And I loved your classes, sir. During final years, I mean, your medicine was really helped me a lot, sir.
Okay.
It's very interesting. Yes.
Great. I think we are very happy to hear of your success, and I'm sure you're going to have an amazing journey in the future also. So, Lakshita, one final thing is ki, 2 questions I want to ask you. One is ki, so many of your classmates also must have studied. You also studied. What different thing that you did that you do you think that you did that helped you get this rank compared to all your other people around you?
I usually read my notes in a fast mode, sir. I can't retain everything, so I have to read the notes again and again in order to retain at least like 80% of what I read, sir. So doing revisions, many revisions is very important. It's the key, and
That
also
helped you a lot.
yes, sir.
Multiple revisions.
Multiple revisions is very important in order to retain stuff, and also giving GTs very regularly is very important, sir. It helps you to improve your score, overall score.
Okay. So if you were to find, let's say your second year, supposing one of your juniors are asking you second year, "Ki, ma'am, what should I do to prepare now?" What advice would you give him or her?
Uh, you should be very strong in the basics. During second year, you have to like again go through the first year subjects. Anatomy. Those subjects have to be very strong. So if it's very strong, final year subjects like medicine and surgery becomes very easy. If your scores are very strong, means but if the foundation is strong, means the final year subjects becomes very easy. So to concentrate in the basics.
Great. How was the Chennai staff, Roshan, Vamsi?
Yeah, they're really good, sir.
Right. So I think it's been really great talking to you, Lakshita.
Thank you.
And any final words of advice for your juniors? We'll conclude with that.
To be very consistent and to not give up, even if the time is very less. If you're very consistent and if you don't give up, you can achieve anything.
Great, great. Huge congratulations to you once again,
Thank
and
you.
all the best. What subject are you planning to take?
If possible, radiology, sir.
Great,
Radiodiagnosis.
great, great. Huge congratulations once again. All the best. All the
Thank
best,
you.
Lakshita.
Thank you, sir.